What's up, guys? This is Jay from COI. So we have some interesting news out of Florida, um, and it has to do with the reporting on the death tallies from suspected coronavirus and confirmed coronavirus deaths. The Tampa Bay Times reports that Florida State's Health Department intervened earlier this month to suppress the medical examiner's reports, which regularly showed death totals that were 10% higher than the official tallies put out by the state. For the past 9 days, no reports from the medical examiners have been made available to the public, and there's no indication of when they will be released in the future. Dr. Stephen Nelson, the chairman of the State Medical Examiners Commission, tells the Tampa Bay Times that the state officials have told him they're planning to remove probable cause of death from the examiner's report, which would make it impossible to tell how many people the examiner believes have died from COVID-19. Um, Nelson said there is no different than any other public record we deal with. It's paid for by the taxpayers, and the taxpayers have the right to know. The Tampa Bay Times also notes that the Florida state government has shown a pattern of suppressing information about the disease. Last month, it tried to persuade the medical examiner's office in Miami to restrict access to its death records, according to the Miami Herald and correspondence between the two agencies obtained by the Times. There was more than a little influence in trying to restrict public access to death records due to COVID-19. That's that's disgusting. It really is. You have the state who's trying to hide, you know, very relevant medical information from the public. And one thing I do want to touch on before we go too far from this, when we say probable cause, I just want to be clear because I've heard people make that argument. Well, they didn't have it; it was probable cause. That's why New York's numbers went up, and it could have been anything else. So to obtain that status of probable cause, you have to show every symptom that somebody with COVID-19 did. You have to essentially die in the same manners. I have heard many cases, and unfortunately in California, where people have died from complications of strokes that now they're like, oh, that probably was actually COVID-19. And it didn't even get tallied as a COVID-19 death. But because strokes were not, at that time, were not consistent with COVID-19, they did not go into that um, tally. Now we're finding out, yeah, strokes are actually fairly, I wouldn't say common, but they're becoming a more of a regularity with COVID-19 than they were prior. So we got a few things. Number one, this is Florida. This is what Florida does, and this is why Florida is Florida. And if you live in Florida, I apologize, but what the fuck is wrong with Florida? And I feel like that's one question everyone always asks because how often do you see? I mean, it's the Florida man. That's all you have to say. Um, you can maybe see why when that's your government, when they are actively suppressing your knowledge about a deadly pandemic in your state. To what? Well, what's happened recently? They've reopened the beaches. Governor DeSantis has basically said we're reopening. The economy's a much bigger problem, and in turn, he's actively suppressing your knowledge about the cases and the deaths tied to why it was shut down to begin with. It's a very disturbing mark, especially if you live in Florida. Something you should definitely be aware of. And honestly, I hate to say it, but you should be aware of that in every state because this isn't just a Florida outline. I've only seen this report coming out, but I guarantee you there's going to be a few more through different states. I know my state here in Kansas has actually been doing the same thing when it comes to testing. I had a conversation with a few medical professionals at a local hospital just a couple days ago, and I had inquired about how can you get a test, how does it work, and they said, look, we were told behind closed doors, I can't use names, but we were told behind closed doors that if somebody has all the symptoms tied to coronavirus, but they're under the age of 65 and you believe they're going to be fine, don't test them. And it's basically like, don't ask, don't tell. I don't want to know about it. I don't have to report on it. Just let it happen. And I really would be curious when this is all over if we go back and we look at deaths in nursing homes and, um, flu like deaths that we might see, that we missed a whole lot of cases here in this country. I really wouldn't be surprised if that's the case. But anyway, guys, I just want to let you know about that. It's a very big story that very few people are talking about right now, and it should be what everyone is concerned with. As even if you're not from Florida, the fact that a state is doing that here in this country, putting their people out there, risking their lives for what, the economy, to not be wrong when they said, hey, we're reopening the beaches. What is it? They're hiding it for some reason. We all know what it is. Anyway, guys, curious what your thoughts are on that. You have a good one. Take care.